My name's Janetta Salvalaggio, and I was the co-chair of the Edmonton Zone Medical Staff Association's Opioid Poisoning Committee. And I want to thank the Edmonton Zone Medical Staff Association for the opportunity to advocate on something that is so incredibly near and dear to my heart and to the heart of everyone on this committee. I would want to put a special shout out to Jennifer Robbins, our project manager, and to Bobby Joe, of course, as well as my co-chair, Cheryl Mack. Everyone on this committee, those who are public facing and private, were united by a number of things. We were witnessing health system strain as a result of opioid poisonings in our communities. We were united by moral distress, not being able to do what we knew was the right thing due to a variety of policy barriers. And we were also united in grief. It's very hard to witness preventable health outcomes, preventable deaths, real time, and not feel the impact personally. And so we collectively, we found strength in our collective and opted to counter some of the prevailing narratives around out there on what is going on. We knew that we wanted to talk about how this is not an addiction crisis, but it's a drug toxicity crisis. We wanted to reach out to the public. We wanted to reach out to policymakers. We wanted to reach out to our fellow physicians and talk about if we reimagined the policy landscape such that people lived and people thrived rather than barely surviving, what might that look like? So we did a number of things. We did a bunch of awareness raising, through the public. We did a memorial neighborhood by neighborhood of people who had lost loved ones in each neighborhood. We pushed back on the lack of timely and accessible and local level data in order to guide decision making. We asked for more data transparency. We also reached out to youth in our community and sponsored a youth competition about what the opioid poisoning crisis means to them. We did a lot in the way of just reaching out with public statements and speaking to media, reaching out to the Minister of Addiction and Mental Health and his colleagues in caucus, provincially, asking, why not institute more community-level harm reduction measures to help counter the massive system strain that we were witnessing as a result not only of COVID, but of this other public health emergency. You really just got a lot more folks, I hope, thinking about what was really going on beneath the surface and in all of the noise of what's going on in our society right now. So we also reached out to a bunch of people who chose to partner with us in this work. These included people who were directly affected, either with lived or lived experience of drug use, as well as the people who love them, their neighbors, their caregivers, people who did frontline outreach work, people who are responding to drug poisonings on the streets of Edmonton and elsewhere. And we also reached out to people with some policy expertise and health service expertise. And we got their ideas in addition to reviewing what we know about evidence-informed policy and decision-making. And we came up with a bunch of excellent ideas, and the ideas we came up with, the policy recommendations we came up with, were richer for it. So I thank everyone, and they know who they are, but I think everyone who was willing to partner with us on this, physician and non-physician alike. Some of the things that we talked about were plotting the fact that we have more access to things like addiction treatment, but also asking that it be acknowledged with investment, that it be acknowledged that treatment alone isn't enough, and that it can't exist in a silo away from harm reduction measures that help people stay alive in this moment. And so we decided to focus our policy recommendations on the gaps in policy. We discussed things like safer supply, a regulated supply of opioids. We talked about decriminalization of drugs for personal use. We talked about enhancing and expanding supervised consumption services, particularly in-person ones. We did this because we knew that these were things that were immediate and potentially very feasible within our jurisdiction measures. Now, we know that some people were listening. We know that the feds were listening. The federal NDP caucus put forward a bill in Parliament and reached out to us and to others, of course, in preparation for that bill. We know that the City of Edmonton is exploring decriminalization insofar as a decrim zone here in the city. we're excited about this. We're excited about the opportunity to have that impact. And we are really, really thankful that our leaders have been listening as they have. We also submitted recommendations to the province, and when policy announcements came out, we responded with evidence and with compassion. And those are on the public record. And I hope that people think about this when they get out the vote here in the coming year. I've said thank you to the EZMSA and thank you to my colleagues within the committee, and thank you to the people who partnered with us directly. But I want to say thank you to members of the public who reached out to us very early and who sent their gratitude in a variety of forms for just speaking out and reaching out and having the courage to do it in a very difficult time. That kept our group going. We knew we were on the right track. When we knew that people who had lived in living experience were hearing this message and feeling that they weren't alone in wanting different and wanting better. So that meant the world to us, and I just want to thank every member of the public who was listening and chose to act in whatever way they could to influence policy. So thank you so much to the EZMSA for this opportunity.